Welcome to this educational video about bronchiectasis. We'll explore what bronchiectasis is, what causes it, how it affects your body, and the ways it can be managed. So, let's dive in! Bronchiectasis isn't a single disease, but rather the result of another condition. It's caused by damage to the airways of the lungs, called the bronchi. This damage often stems from recurring infections, such as pneumonia or whooping cough, especially in childhood. Other causes include genetic conditions like cystic fibrosis, immune system disorders such as common variable immunodeficiency, allergic bronchopulmonary aspergillosis (CBPA), and sometimes even aspiration of foreign objects. In some cases, the cause remains unknown, which we refer to as idiopathic bronchiectasis. The underlying problem in bronchiectasis is damaged and widened airways. These damaged airways lose their ability to clear mucus effectively. Normally, tiny hair-like structures called cilia sweep mucus upwards, removing bacteria and debris. But in bronchiectasis, these cilia are often impaired, and the widened airways become a breeding ground for bacteria. The trapped mucus becomes thick and sticky, leading to chronic infections and inflammation. This cycle of infection, inflammation, and further airway damage perpetuates the disease, leading to progressive and irreversible changes in lung structure. Bronchiectasis can affect people of all ages and backgrounds, but some populations are more at risk. Individuals with cystic fibrosis have a higher likelihood of developing bronchiectasis. Similarly, those with immune deficiencies or chronic lung infections are also at increased risk. While specific prevalence rates vary depending on geographic location and underlying causes, it's important to recognize that bronchiectasis is often underdiagnosed, as its symptoms can mimic other respiratory conditions. The symptoms of bronchiectasis can vary in severity but often include a chronic cough, which produces large amounts of phlegm, or sputum. This sputum may be discolored, ranging from white to yellow to green, and can sometimes contain blood. Other common symptoms are shortness of breath, wheezing, chest pain, and recurrent respiratory infections. Individuals may also experience fatigue, weight loss, and clubbing of the fingers, a physical sign where the fingertips become rounded and widened. Diagnosing bronchiectasis typically involves a combination of clinical evaluation, imaging, and lab tests. A doctor will listen to your lungs for abnormal sounds like crackles or wheezes. A chest X-ray can provide an initial assessment, but a high-resolution computed tomography, or HRCT scan, is the gold standard for confirming the diagnosis. The HCT scan can clearly visualize the widened airways characteristic of bronchiectasis. Sputum cultures are often performed to identify any bacteria present and guide antibiotic treatment. Additional tests might be done to identify underlying causes, such as cystic fibrosis or immune deficiencies. While bronchiectasis doesn't have distinct types, it is often classified based on its underlying cause or the pattern of airway damage seen on imaging. For example, it may be categorized as cystic fibrosis related or non-cystic fibrosis related. Some classification systems also describe the pattern of airway involvement as cylindrical, varicose, or saccular, referring to the shape of the widened airways. Understanding these classifications can help guide treatment strategies and prognosis. Unfortunately, there's no cure for bronchiectasis, but treatment focuses on managing symptoms, preventing infections, and slowing disease progression. Airway clearance techniques are essential, involving methods like chest physiotherapy, using devices to loosen and clear mucus, and practicing breathing exercises. Antibiotics are prescribed to treat acute infections, and in some cases, prophylactic antibiotics may be used to prevent recurrent infections. Bronchodilators can help open up the airways and make breathing easier. In severe cases, surgery to remove damaged lung tissue may be considered, but it's usually reserved for localized disease. Pulmonary rehabilitation programs can also provide valuable support and education on managing the condition. Preventing bronchiectasis involves addressing risk factors and promptly treating underlying conditions. Ensuring children receive vaccinations against respiratory illnesses like measles, whooping cough, and pneumonia can reduce the risk of infection-related bronchiectasis. Avoiding smoking and exposure to environmental pollutants can also protect the lungs. Early and aggressive treatment of lung infections is crucial to prevent airway damage. In individuals with known risk factors, regular monitoring and proactive management can help slow disease progression. The prognosis for bronchiectasis varies depending on the severity of the disease, the underlying cause, and the effectiveness of treatment. With proper management, many individuals can live relatively normal lives. However, bronchiectasis is a chronic condition, and lung function may gradually decline over time. Recent research focuses on developing new therapies to reduce inflammation, improve mucus clearance, and prevent infections. Novel antibiotic strategies, anti-inflammatory medications, and mucolytic agents are showing promise in improving outcomes for patients with bronchiectasis. There's ongoing research into gene therapies for cystic fibrosis, related bronchiectasis, and efforts to identify biomarkers that can predict disease progression and treatment response.